Are you approaching 65 and are you soon to be eligible for Medicare? Or already eligible, you may be wondering which Medicare plan is the best. Or maybe a better question is, which Medicare plan is the best for me? Is it just original Medicare, or do I need a Medicare Supplement plan? And what's all this I hear about the Medicare Advantage program? Hi, I'm Rick Teska with Strive Medicare, and today I'm going to help you gain a better understanding of which Medicare plan is the best for you. We will first talk about original Medicare, then Medicare Supplements, and lastly, Medicare Advantage. Learning about Medicare options can feel overwhelming. Many aren't sure where to begin. With several parts, plan, options, and coverage stages, it can be difficult to know which method of receiving your benefits is the best for you. However, once you understand the basics of Medicare, choosing your coverage options will be much easier. We break down some of the essential factors you need to know before choosing a Medicare plan. For many of our regular subscribers, what Medicare is and isn't, and what it covers and what it doesn't cover is familiar. But if you are new to our channel or new to Medicare, I want to just do a brief recap. So Medicare is a government-run health insurance program for people 65 and older and people with disabilities. It helps people pay for some of the costs of medical care, including doctor visits, inpatient hospital stays, and prescription drugs. Medicare covers many, but not all, medical services. Medicare has 4 different parts that each cover a different set of medical costs. Part A covers inpatient hospital stays, skilled nursing care, some home health care, and hospice care. Part B covers doctor visits, lab tests, medical equipment, outpatient medical services, and some preventative care. Part C covers the Medicare Advantage program, which are plans offered by private insurance companies approved by Medicare, covering the services listed in Medicare Parts A and B, and typically Part D. It is a privately administered alternative to being enrolled in original Medicare Parts A and B. Lastly, there is Part D, which is coverage for prescription drugs. While not officially a part of Medicare, Medicare Supplement, also known as Medigap, can be purchased in conjunction with original Medicare coverage to help lower out-of-pocket costs to a beneficiary. Essentially, you are left with 2 options when it comes to covering what Medicare does not. Number 1 is to purchase a Medicare Supplement to work with original Medicare benefits. Number 2 is to enroll in the Medicare Advantage program, which replaces original Medicare. Whichever decision you make will have lasting implications on your health care and the coverage you can expect. Understanding your coverage needs, eligibility, and budget can help you easily narrow down the options. So let's dive in with option number 1, which is to purchase a Medicare Supplement plan. As I mentioned earlier, these plans work with your original Medicare. Original Medicare will pay approximately 80% of your approved healthcare expenses, and a supplement, depending on plan choice, is designed to fill the gap. There are 10 plan types available in most states, and each plan is labeled with a different letter that corresponds with a certain level of basic benefits. In most states, Medigap insurance plans have the same standardized benefits for each letter category. This means that the basic benefits for a Plan A, for example, are the same across every insurance company that sells Plan A, regardless of location. This makes it easy to compare Medicare Supplement insurance plans because the main difference between plans of the same letter category will be the premium cost. Massachusetts, Minnesota, and Wisconsin standardize their Medicare Supplement insurance plans differently from the rest of the country. Plan F and Plan G have historically been the two most popular Medigap plans. However, it's important to note that Plan F is only available to those folks who were eligible for Medicare before January 1st, 2020. As you can see in the Medigap comparison chart, Plan F covers all the gaps in Medicare. Plan G is only slightly different because of the addition of an annual deductible of $233. Because the deductible is so small and the savings on the monthly premium so much, it is one of the more popular options. If you compare the premiums for Plan F versus G, and the reduced premiums save you more than you'll pay out for the Part B deductible, you can see why it's so popular. In recent years, we've also seen a growing interest in what is called the high deductible Plan G. High deductible Plan G is the good alternative to traditional Plan G for those that can absorb some out-of-pocket costs in exchange for a much lower monthly premium. The plan deductible is $2,490 in 2022. Once the deductible is met, you get the same coverage as a regular Plan G. If high deductible Plan G sounds like something you're interested in, click the video here in the top right corner for more information on that plan. If you're interested in high deductible Plan G but want to hear more about your other Medicare options, that video will also be linked at the end of this one. Earlier, I mentioned two options, with the second option being to enroll in a Medicare Advantage plan, also called Part C. These plans are an alternative to the original Medicare. Private companies administer these and they replace your Part A and Part B benefits and sometimes also include Part D. There are different types of Medicare Advantage plans to choose from, including health maintenance organizations, also called HMOs. HMO plans utilize in-network doctors and require referrals for specialists. The next is Preferred Provider Organization, or PPO. PPO plans charge different rates based on in-network or out-of-network services. Private Fee-for-Service, also called PFFS for short, are plans that offer special payment plans in turn for provider flexibility. Special Need Plans, SNPs, help with long-term medical costs for chronic conditions. Lastly, there are medical savings accounts, and these plans are medical savings accounts paired with high deductible health plans. Medicare Advantage offers many different to original Medicare, including convenient coverage, multiple plan options, and long-term savings. There are some disadvantages as well, including provider limitations, additional out-of-pocket costs, and lack of coverage while traveling. While some Medicare Advantage plans offer long-term savings, plan flexibility, and better care, others can lead to fewer provider options, additional costs, and lifestyle changes. Today we talked about original Medicare, whether it is enough, and the best Medicare Supplement plans for those looking for one. We also briefly covered the option of Medicare Advantage plans, what they are, and who they would be a good fit for. With all of these options for Medicare, choosing a plan can be confusing. The best plan for you can be subjective to who you are and what your needs are. To get signed up for Medicare and find which plan best suits your needs, reach out to us by calling the number below or schedule a free consultation online through our website linked in the description.